Hello friends, welcome back to my channel. Myself Dr. Neha. Here I am going to discuss about the anatomy of fibula. Fibula is the lateral bone of the leg and is homologous to the ulna. As we all know that in the skeleton of the leg we have two bones, that is the tibia and the fibula. Tibia lies medially and the fibula lies laterally, and this fibula is corresponding to the ulna, which is lying in the forearm. In Latin, the term fibula means pin. Therefore, lateral bone or the leg is rightly referred as fibula because of its long pin-like bone. It's a long, thin, post-axial bone of the leg and will not take part in the transmission of body weight. Its main function is to give attachment for the muscles and not as a weight bearer. So in this image, we can see the surface projection of these bones, particularly the fibular head is emerging at the knee at the marked area. Then this is the fibula. Now the articulations of the fibula, it has three main articulations, that is the three main joints formed by this bone. Proximal tibiofibular joint, which articulates with the lateral condyle of tibia at the upper end. Distal tibiofibular joint, which articulates with the fibula notch at the tibia. Then ankle joint, which articulates with the talus of the foot. So these are the two articulations are shown in this image. The proximal is with the upper end of tibia and this is the distal with the lower end of tibia. Now at the proximal end, the fibula has an enlarged head which contains a facet for articulation with the lateral condyle of tibia. On the posterior and lateral surface of the fibular neck, there is an important nerve which is related to this bone. This is the common peroneal nerve. The shaft has three surfaces: anterior, lateral and posterior surface. The leg is split into three compartments and each surface faces its respective compartment. That is, anterior surface faces anteriorly of the anterior compartment. And distally, the lateral surface continues inferiorly and is known as lateral malleolus. So lateral malleolus is an important than medial malleolus and can be palpated at the ankle on the lateral side of the leg. So here we can see the upper end. In the upper end, this is the head, this is neck, and this is the lateral malleolus. The upper end is possessing the head having a circular facet which is articulating with the upper end of tibia. Also, an upward projection is also found which is posterolateral to this facet. This is known as styloid process. The shaft has anterior, interosseous and posterior borders and medial, lateral and posterior surfaces. Nonetheless, only interosseous border is clear cut. Other edges and surfaces are vague. And the lower end, it is flattened and bears a triangular articular facet on its medial surface for articulation with the talus. So at the lower end, that is at this point on the medial side, we have facet. This facet articulates with the lower end of tibia and forms distal tibiofibular joint. So here we can see the site determination and anatomical position of the fibula. The site can be determined by its round end, which is termed as head, which is directed upwards. Its comparatively flattened end is pointed downwards, and a triangular facet on its lower end faces medially, and the depression at the lower end, which is known as malleolar fossa, is located behind and below the triangular articular facet at this end. Now the upper end is slightly expanded in all directions. The superior surface bears a circular articular facet which articulates with the lateral condyle of tibia and forms proximal tibiofibular joint. The apex of the head or the styloid process projects upward from its posterolateral aspect, and the constriction immediately below the head is known as neck of the fibula. The head is round and bulky and presents three features: an oval or circular facet on its superior aspect for articulation together with the lateral condyle of tibia. Second is a stylet process posterolateral to the articular facet, which gives connection to the fibular collateral ligament. This is the ligament of knee joint. And a sloping surface in front of the stylet process for C-shaped insertion of the biceps femoris. Biceps femoris is a muscle of the back of thigh. So here we can see in the diagram the apex, which is known as the stylet process, then the head, and then the neck of the fibula. Neck, it is a constriction below the head linking it with the shaft, and the neck we have two important relation. On the lateral side of the neck we have common peroneal nerve, and on the medial side we have anterior tibial artery. Now come to the shaft of the fibula. Now the shaft has three borders and three surfaces. The borders are anterior, posterior, and interosseous border, and the three surfaces are medial, lateral, and posterior surface. The shaft shows very considerable variation in its form because it is molded by the muscles attached to it. So here we can see the medial, posterior, and lateral surfaces respectively in the diagram. Now all the borders are very sharp but not very straight, and the fibula shows slight torsion. The medial border is sometimes known as medial crest in the posterior surface, and the fibula has fourth interosseous border found in the middle of the medial surface. Now we come to the anterior border. It begins just below the anterior aspect of the head. At its lower end, it divides to enclose an elongated triangular area which is continuous with the lateral surface of the lateral malleolus. It gives connection to the anterior intermuscular septum of the leg in its upper 3/4. Now posterior border, it is rounded. Its upper end lies in line with the stylet process. Below, the border is continuous with the medial margin of the groove on the back of the lateral malleolus. It goes from the posterior aspect of the head to the lateral margin of the groove on the posterior surface of the lateral malleolus. The posterior intermuscular septum of the leg is connected to the upper 3/4. Now the interosseous or medial border. The interosseous or medial border lies just medial to the anterior border, but on a more posterior plane. It terminates below at the upper end of a roughened area above the talar facet of the lateral malleolus. In its upper 2/3, the interosseous border lies very close to the anterior border and may be indistinguishable from it. Interosseous membrane is connected along its entire length, with the exception at the upper end to make a gap for the passage of anterior tibial vessels. Now the surfaces. The medial surface, also known as extensor surface, it lies between the anterior and the interosseous border. In its upper 2/3 part, it is very narrow and measuring up to 1 mm or less. The lateral surface lies between the anterior and the posterior borders. It is twisted backwards in its lower part. The posterior surface, also known as flexor surface, it is the largest of the three surfaces. It lies between the interosseous and posterior borders. In its upper 2/3, it is divided into two parts by vertical ridge known as medial crest. So this is the schematic diagram to show you the borders and the surfaces of the fibula. In this diagram we can see the anterior border, there is medial border and the posterior border, and three surfaces: anterior, lateral, and posterior surface. Now the medial surface, also known as extensor surface, it's narrow and it's located between the anterior and the interosseous border. It gives origin to extensor digitorum longus in the upper 3/4 part and extensor hallucis longus in the posterior half of the middle 2/4 and medial to the extensor digitorum longus. In the lower quarter, it gives origin to the peroneus tertius. So this diagram is the again schematic diagram to show you the attachment of the shaft of the fibula. So if you can't remember the attachments on the bone itself, then you can draw this diagram also in your exams, and you can learn this diagram for your exam. This is the schematic diagram for the attachments of the fibula. In this we have divided each surface into three parts: the upper, middle, and lower parts, and again the middle part is divided into anterior half and the posterior half. So by the way of this manner we can learn the attachments of the fibula. Then on the lateral surface, that is peroneal surface, we have attachments of only two muscles, that is peroneus longus and brevis. The peroneus longus originates from the upper 2/3 part and posterior half of the middle 1/3, while peroneus brevis originates from the anterior half of its middle 1/3 and entire width of the lower 1/3 part. So this is the attachments on the fibula on the anterior surface and on the posterior surface. Then come to the posterior surface, that is flexor surface. It's wide ranging and is located between the interosseous and the posterior edges. Its upper 2/3 is split into medial concave and a flattened lateral part by a sharp vertical medial crest. The fascia covering the tibialis posterior is connected to the medial crest, and the medial concave part gives origin to the tibialis posterior. The lateral flattened part gives origin to the soleus muscle in the upper quarter and to the flexor hallucis longus in the lower 3/4. The peroneal artery descends along the medial crest, and the nutrient artery, which is a branch of peroneal artery, enters the nutrient foramen just present above the middle of the posterior surface. So this is the lower end of the fibula. In this we can see the malleolar fossa. This is the malleolar fossa located below and behind the facet, triangular facet on the medial surface, and this is the triangular facet on the medial surface of lower end of fibula for articulation with the talus. So here we can see the triangular subcutaneous area, the lateral malleolus. Now at the lower end of the fibula, which is enlarged anterior posteriorly to form four surfaces: anterior, posterior, medial and the lateral. The anterior surface is rough and round. It gives connection to the anterior talofibular ligament. A notch at its lower border gives connection to the calcaneofibular ligament. Calcaneofibular ligament is a ligament of ankle joint. Posterior surface presents a groove which lodges tendons of peroneus brevis and peroneus longus, the latter being superficial to the former. The medial surface presents a triangular articular surface in the front and a concave depression known as malleolar fossa below and behind. The lateral surface is triangular and subcutaneous. So the malleolar fossa gives connection to or attachment to posterior tibiafibular ligament and its lower part to the posterior talofibular ligament. So in the diagram we can see the posterior tibiafibular ligament and the posterior talofibular ligament. Now the fibula. Fibula is a sesamoid bone which is found in the tendon of gastrocnemius, lateral head of gastrocnemius. It is another sesamoid bone found in the lower limb. Now ossification of the fibula. It ossifies from three centers of ossification, two secondary and one primary. The primary centers appear at the age of 8th week of the intrauterine life, and the secondary center for the upper end arises at the age of 3 to 4 years, and for the lower end it arises at the age of 1 to 2 years. The time of fusion for the secondary ossification center of the upper end is the 20 year, and the ossification for the lower end is 18 years. Now the applied. Fibula can be used for whole bone transplant since it is superficial and subcutaneous and not a major structure is attached to the fibula. And the children, the fibula can be used to span a long gap in the tibia, as you can see in the image. Then second is the fibula at the neck. We have the common peroneal nerve. This can be rolled against the neck of the fibula, and this nerve is commonly injured at this point because it is lying superficially and close to the neck of the fibula. Then next is the fibular fracture. The fibula can be fractured 2 to 5 cm proximal to the distal end of the lateral malleolus, as you can see in the image. It is the common related to the fracture dislocation of the ankle. This completes our topic. Thank you so much.